Everyone, this is Hitaishi and I'm here to present on movement analysis and biomedical aspects. Movement analysis identifies specific deficits and flexibility and stability with strength enabling targeted rehabilitation and injury prevention. Understanding the biomedical aspect addresses the underlying physiology and biomedical factors affecting performance and recovery. This holistic approach enhances performance during injuries and ensures effective recovery by considering moving on to athlete's introduction. This study revolves around a female athlete who is a professional cricket player with 5 years of experience. Representing at the state level, she is a batting all-rounder and is expected excel with both bat and ball. Unfortunately, 3 months ago she suffered a grade 2 hamstring strain. The athlete needs will be recovering from hamstring strain, improvement in flexibility, stability, and strength, prevention of future injuries. Cricket is a dynamic sport. It requires a blend of strength, agility, and decision making, movement analysis. Also, sport involves rapid, explosive movements such as running between wickets, powerful batting strokes, and dynamic fielding. The objective of movement assessment is to know the athlete's physical conditions and areas needed to improvement. Active straight leg raise test assesses hamstring flexibility and hip mobility. Also indicates potential hamstring tightness for injury impact. Star excursion balance test evaluates proprioception and dynamic balance and identify asymmetries and deficits in dynamic stability. Single leg glute bridge test. It tests the glute strength and endurance with hip stability and potential weaknesses in gluteal muscles. Active straight leg raise test. This test is commonly used to measure hamstring flexibility. The test requires 70 and a 90-degree marked angle on the wall. The athlete lies supine with both legs fully extended on the floor, positioning their hip bone at the 90-degree vertical angle. The athlete slowly raises their tested leg with the knee fully extended and the ankle in the maximal dorsiflexion. Throughout the test, the athlete's non-tested leg should be kept firmly on the ground. The assessor observes the test at the maximum range in relation to the marked angle and identify if there are any compensatory movement. The athlete performs 3 trials and the maximum range of motion is considered for the analysis. The star excursion balance test measures dynamic balance and proprioception as well as bilateral asymmetries. Before that, the leg length assessment is taken. A star pattern is marked on the wall with 8 vectors extending from a central point, each separated by 45 degrees. Athlete stands at the center of the grid with their hands on their hips. They perform the test in the following order: anterior, diagonal, medial, posterior, posterior, posterior lateral, and anterior lateral. They reach as far as possible along each direction with their non-stance leg lightly touching the line and then returning to the center without losing balance. Athletes are allowed 6 trials before the test and must perform 3 trials with both the legs. Single leg glute bridge test. The single leg glute bridge test requires a standard treatment table and a box. The athlete lies supine on the bench with one leg bent at 90 degrees and the other leg extended. The feet are placed lower than the supine body and the arms across the chest. The athlete then performs the glute bridge by placing one leg on the box and extending the other leg. The athlete then lifts the hip towards the ceiling, maintaining a straight alignment from shoulders to knee, and then lowers the hip back down to starting position without the glute touching the table. The athlete is instructed to perform 20 repetitions with both the limbs. Any compensatory movements will be noted. As we see the ASLR result, this indicates the left leg range of motion exceeds the test upper limit of 90 degrees, showing a good hamstring stability and flexibility. The range of motion in the right leg is slightly lesser compared to the left leg and still functional. This indicates sufficient hamstring flexibility and hip mobility, as it falls within acceptable range of 70 to 90 degree. Star excursion balance test. As we look into the graph, athlete shows good proprioception and dynamic balance. The scores of posterior, posterolateral, and anterolateral are slightly lower on the right leg, aligning with the tightness and recent injury. Although these differences are minor, they indicate asymmetry that might predispose the injuries. Especially in sports like cricket, it requires rapid change of direction and high speed running. The single leg glute bridge test. The gluteal strength and endurance are balanced in both the legs with 20 repetitions. The athlete performs 20 repetitions with both the legs, and assessor observes slight knee instability and inability to lift the pelvis evenly. Hence, we could observe weakness on the gluteal muscles. The goal of the 4-week program is to rehabilitate the right hamstring strain, address the muscle imbalances and asymmetries with flexibility, strength, and plyometrics, enhance functional performance specific to cricket. We have followed FITT principles with 2 sessions per week of strength session, which is complemented by 2 running sessions, starting with low, moderate to high intensity with progressively overloading. The time duration would be from 15 minutes to 60 minutes. The week 1 and 2 focuses on foundation and building strength. Exercise such as glute bridge, bird dog, single leg Romanian deadlift, etc. gradually increase the load and complexity. Week 3 and 4 focuses on high intensity and plyometrics, where the introduction to plyometrics to sport specific were incorporated. Exercises such as box jumps, lateral band work, eccentric calf raises, etc. that ensures safe progression from foundation strength to high intensity activities, which is cricket specific movements. Running session is a key component. It is important to reintroduce running so that the hamstring is fully regains its function and to regain the confidence in the hamstring. The 4-week program is designed to address, identify deficits, and progressively restore the athlete's functionality. Emphasis on continuous monitoring and adaptation to optimize recovery and performance. The goal is to safely return to cricket with enhanced performance and reduce the risk of re-injury. Here are the references I have used to complete my assignment. It was a great learning experience. Thank you.